Alistair Burns is my name, and I'm the National Clinical Director for Dementia in NHS England. It's a great privilege and a pleasure to do a brief introduction to two videos that you will see linked about the experience of having a diagnosis of dementia and being a carer for someone with dementia. These videos came out of a meeting that we had in June 2013, where we were with a group of professionals, people with dementia, carers and policymakers, just reviewing some of the issues around the diagnosis of dementia and the issues and coming to a consensus about some of the things that were important. And as part of a number of presentations we had, it was a great privilege to hear from Barbara Woodward-Carleton and from Peter Dunlop. Barbara emphasises very much the issues of the importance of a diagnosis, how that allowed access, it made meaning out of some of the symptoms, and it allowed access to care, and a very personal testimony and incredibly powerful. Peter was someone, a consultant in the National Health Service, who received a diagnosis of dementia and Alzheimer's disease, and the implications that had and the importance of the diagnosis, I think, is underscored extremely well. Like many of you, I go to a lot of meetings and hear a lot of talks, and it became clear at the meeting that we had that the two most powerful things that were there were the descriptions from Barbara and Peter about their experiences. It cut through many of the other things that we were doing. It got right to the point and right to the nub of the things that we should be doing, and it was a privilege to hear them. And thank you very much to Barbara and Peter for being at the meeting and giving up your time and your experiences.
Peter Dunlop, and I have Alzheimer's disease. Before my diagnosis, I was an O&G consultant. I had first concerns that something was wrong in the autumn of '08, when I was in my mid-50s, when I had episodes of forgetfulness, including forgetting my parents' phone number, where the clock was in my car, and being unable to remember the names of drugs that I frequently described. My wife, who was also a doctor, said I'd always had a lousy memory, and these were nothing more than normal senior moments. However, I was aware that these were different, and I also didn't feel as mentally sharp as before. After the third episode, I consulted my GP, who I knew well, and he took me very seriously and referred me to the local memory clinic. At this stage, I was working as usual, and I'd spoken to my colleagues, who had been very supportive, and they didn't feel that it was adversely affecting my work. In February '09, I had my first basic memory tests at home. Initially, the sister looked at me rather dubiously, but by the end of the session, she looked more worried than anything else. Some weeks later, I had further, more intensive memory tests, which I failed miserably. My consultant confirmed that Alzheimer's was a possibility, and he organised a 3-stage brain MRI. When the results were through, I was referred for a second opinion, and Alzheimer's was confirmed, as my left hippocampus was 2 millimetres smaller than the right. I was given the diagnosis on a Friday afternoon, and after getting home I phoned the GMC and the BMA about continuing to practice, and their response was that I could continue to practice if my colleagues were happy. I also phoned the Medical Protection Society, and I was put through to a barrister. After explaining the diagnosis, there was a very long pause before she embarked on lasting power of attorney. I took the hint and revoked my licence to practice medicine on the Monday morning. I was fortunate to have a quick diagnosis. It was about 8 months from my first episode. Having a diagnosis was a relief tempered by the unknown, having to sort out sudden retirement, finances, unknown prognosis, and I've been fortunate to have a lot of support from my wife and colleagues. Other problems have appeared out of the woodwork, particularly loss of numeracy. I have great difficulty in calculating change when shopping, and I therefore use a debit card rather than cash, even for minor transactions. I also find it difficult to work out what time it is, but that can be useful when I'm out fishing. These changes also undermine confidence in everyday life, and simple tasks of going out can take on major planning just to ensure that I don't get lost or forget something. Sat-nav is useful for getting there and back home. Since my diagnosis, I was initially treated with Aricept, but I've now been upgraded to Memantine, and the lights came on again. I feel much clearer headed, and other co-sufferers have also had the same benefit. Since my diagnosis, I've met several other people in their 50s who've had some years of symptoms before the diagnosis was made, leading to a lot of distress for them when they'd been told that they were depressed, neurotic or lazy. Therefore, they've not been given the correct therapy and support, and in one instance they've even been given ECT for their supposed depression, which unsurprisingly didn't work. These people had held responsible high-powered jobs and been written off through ignorance. Following diagnosis, I was not offered any immediate follow-up or support. Whilst this didn't trouble me, my wife would have welcomed such an offer, even a phone number for someone that she could contact. I'm now a member of an excellent local group called Educate, which provides peer support for younger dementia sufferers and fulfills a valuable role in us talking and educating local people about dementia. There are, however, in general, still a lack of support networks and admiral nurses. Overall, having a dementia is a pain in the, well, you can work that out. Life has to be ordered to try and remember what happens when or where everything is, who is going where, at what time, and most importantly, where my latest grubby piece of paper with the latest list of my immediate jobs. Thank you for listening.
Timely diagnosis of dementia. I consider myself, as the person who looked after my mother who had dementia, as very fortunate indeed. My mother had been looking after my father for 19 years, who had Parkinson's disease, and I had noticed during the last years when he really was incredibly ill that she really wasn't able to look after the house properly, and there were all sorts of muddles and confusions, and I put it down to the fact that she was getting on, my father was very ill, and she did just what was necessary. When my father died, because so much needed to be done in the house, it was decided that she would come to stay with us in North Yorkshire. She was living in the West Midlands, and she came to stay with us for several weeks while things were put right. And it was during that time that we began to see how odd her memory was. We began to see just how confused she was and how different her behaviour was from what it had always been. And we were really quite worried about that, and we talked about it together, but we didn't talk about it with my mother. But I can remember once walking round the green with my mother, and she said to me, "I don't want to go back." And actually, I was really pleased she said that, because my husband had said to me, you know, your mother can't live alone. And so she came to live with us, and we knew she was muddled and we knew she was confused, but we didn't know why. When I made a routine visit to the GP with her, we were very fortunate because we got a locum. The locum happened to be a geriatrician by training, and she just happened to be in her practice because she'd followed her husband up to my part of the world and was looking for work. And she talked to me and she said, I think your mother has Alzheimer's disease. And I was really shocked. I couldn't really quite believe that. But she was a geriatrician, and she did say, we do need to do some more investigation. When I went away and talked about it and thought about it, I thought, yes, she's got memory problems. She is confused. Following that, we had an old age psychiatrist from the local hospital to the house who gave her all sorts of tests, and he too felt the diagnosis was Alzheimer's disease. Following that, she went to a hospital quite a long way away for brain scanning, and again the diagnosis was that she had Alzheimer's disease. Now, I have to say, I was incredibly relieved to know why my mother was as she was, why she was behaving as she was. It helped me to understand what was going on. It explained to me and to the family the inexplicable. And so we were really pleased to know that we'd got a diagnosis, and that particularly we hadn't got a misdiagnosis. We hadn't got depression or grief or stress or any of the things that might be mistaken for dementia. We also knew that she hadn't got a chest infection, she hadn't got a urinary tract infection, and so we felt confident that that diagnosis was right. At that time, there was actually no suggestion of any kind of treatment. I did a lot of reading and a lot of looking up to try to come to terms with the diagnosis and understand exactly what was happening. It was very, very important to me that I knew this was an organic disease, that she was in no way responsible for what was happening. And it meant actually, because I had more understanding and because I had more knowledge, I was able, I feel, to cope better with it. There were times when I didn't cope very well, and my family would tell you that. From my doctor's surgery, we were allocated, if that's the right word, a psychiatric community nurse. She would come to see my mother once a month. She actually always came at the end of the day, and she always stayed for about an hour. I would make myself scarce, and when the hour was nearly up, I would go back in with a tray of tea and biscuits, and we would have a little talk. When I walked her out to the car, she would then say, yes, I can see your mother is whatever. It might be that she was getting worse or she was more muddled, but she was a fantastic person to have at the end of the phone. And she did say, I'm always at the end of the phone, Barbara, ring me up. And because she was a trained nurse as well as a psychiatric nurse, if there were physical problems, then again I could ask her about those. My mother did get worse over time, and she was more muddled and she was more confused. And by chance, we were put in touch with the local Alzheimer's Society, who ran a day centre. My mother went to that day centre twice a week and actually really loved it. Now, I know that day centres are not right for everyone, but for my mother, she liked the food, she liked the staff, she liked the people. She did have insight into the fact that she had memory problems, and sometimes the staff would say she'd been with other ladies and men and they'd been talking about their memory problems, and because they all had the same difficulties, they were able to be honest and open with each other. I did get a lot of help from the Alzheimer's Society because they gave me so much information and enabled me to understand more what was going on, and particularly what would help in looking after my mother. We were too signposted to the benefits we might have to think about, to financial arrangements we might have to make, to legal possibilities. And we did, in fact, my family and I, go to see our local solicitor with my mother while she certainly still had mental capacity, and we set up an enduring power of attorney. This was invaluable because my mother had real problems with money, and she was more than delighted, she said, for me to go onto her bank accounts and also to be there to help when she was selling her house in the Midlands because she moved up to be with us. The other things are quite interesting. I was talking recently to a man who has been diagnosed with early onset dementia. He is in his early 50s. His wife was with him. His company had tried really hard to keep him employed but couldn't. His wife had to give up work so that she could look after him, but he was not allowed by the benefits agency to have any benefits because dementia is not seen as an illness in its own right. It needs to be Alzheimer's disease or Parkinson's with dementia. And that, I think, is a really interesting thing. And I found, because I got sort of shunted into being chairman of the local Alzheimer's Society branch, that one of the things that distressed people was that they got the diagnosis. You don't think to ask questions at that time, and then there was no follow-up. I had assumed that because I had a CPN, everyone got one, but they didn't, and the follow-up, I think, is incredibly important. Towards the end of her life, she became very ill and went for what I thought was nursing respite care at a local nursing home. While she was there, she was taken to the local hospital, and actually it was a very bad experience, and I am haunted by the words she said to me, almost the very last words she said. She said, "I don't like it here." And I sat for hours in that ward with my mother, looking at other people, seeing what happened, and feeling increasingly distressed. So much so that on one of those occasions, speaking to a nurse, I did actually burst into tears. And I said, you don't understand my mother. She has Alzheimer's disease. She was, in fact, in a ward for the elderly, but an acute ward. I came back in the next day and we had another little talk, and she said with a shrug, "Well, actually, I don't know anything about dementia or Alzheimer's disease." And I was really shocked, rigid by that. My mother went back to the home for 2 or 3 days, and again I sat for a long time, and everything I saw there was just fantastic. My mother had sheepskin on the places where she might get pressure sores. They taught me how to feed her with a little syringe. I went in once unexpectedly and found 2 care workers washing her, talking to her, doing her hair, and though she was oblivious to that, the care and the way they talked to her was just unbelievably lovely. And I think she would have known that people were being really, really nice to her. When my mother died, I simply couldn't come to terms with the fact that at the hospital it had been such a bad experience for her and for many other people. I wrote several A4 sides of what I'd seen, what I've heard and what I thought, and I got an appointment with the director of nursing, and she actually said to me, "Nothing you say surprises me. There is a culture of neglect on that ward." And I have to say, to be fair now to that hospital, they have improved things tremendously. And whilst my mother had been into the ward that they kept for people with dementia earlier, I had no anxieties or concerns about that ward. I did too write to all the people who had been so kind. We had to have a social worker at one point, which was a bit difficult when I felt we ought to be able to cope by ourselves. I wrote to the practice because they'd been so thoughtful. I would go up and collect continence pads, and the lady there in the pharmacy would say, "Oh, you don't want to be running backwards and forwards here. I'll give you some extra," which she did. The district nurse would come to our village to see various people, and she'd often pop in, though we hadn't got an appointment, I hadn't been in touch. And she would say, "Oh, I'm in the village. I thought I'd just pop in and see how things were." She was thoughtful too in that she would say, "I noticed your mother's bloods are needed." I've come in to do them now, save you coming up to the surgery, which was 4 miles away. And I have to say that for me, that timely diagnosis was fantastic. It meant we as a family and our friends really understood what was going on. There were 1 or 2 glitches with the surgery, but by and large we had superb care and concern from them. The hospital I've mentioned. I'm pleased to say that now dementia, Alzheimer's disease, whatever we are talking about, is much higher on the agenda. I think hospitals are much better at helping people with dementia. There is still a long way to go, but I'm confident that things are getting better. And one last thing I need to say, which is really confessional. We never did tell my mother that she had Alzheimer's disease. She knew absolutely what Alzheimer's disease was, and I think she would have been absolutely devastated. I'm not sure whether I did the right thing, that though at that time she couldn't have had medication, we still, as then, don't know the cause or the cure. But I would like to have thought that if I was doing this now, I would say what was wrong and that she could actually get onto a clinical trial looking into the treatment, causes, whatever, of dementia.